Hello, Dr. Kilbane here. Quick video today on swimmer's ear. What happens with swimmer's ear is the outer ear canal gets infected, and it can be really painful to the point where you just touch a child's ear, or the classic textbook cases, they take their shirt off and they're screaming from ear pain. Once you have swimmer's ear, it's a good idea to get it treated with an antibiotic drop. But before, if there's just a little bit of pain, or if you know your child's had it in the past, a great thing that we can do is prevent it. So, a little anatomy lesson of the ear. The middle part of the ear is, within this, is behind the eardrum. And then we have the sealed eardrum, and then we have the ear canal. Swimmer's ear happens in that ear canal. And what happens is that you'll get that either lake water, pool water, pond water, and then you maybe have a little wax in the ear, and then the child goes in to itch the ear, and maybe there's a little bacteria under their fingernail, or they scratch their canal, and they start to get a bacterial overgrowth. Sometimes you can get a little bit of a fungal overgrowth, and it just is very painful. And the wax can also serve to hold that lake water or that pool water in the ear, which creates a breeding ground for bacteria and yeast. So what we want to do, and we're talking about kids that don't have ear tubes, kids that don't have a ruptured eardrum. This is just for a healthy ear. Is once you get out from swimming, you take either a hair dryer, or you can do this sort of thing. You can twist the end of the paper towel, and you just want to damp that ear dry as best you can, without sticking anything way inside the ear. If you do twist the end of a paper towel, you can stick that in a little ways and let the child do it, because they're not going to stick it in too far, because they're going to feel it. And that will just gently absorb some of the water. Then you're going to get either hydrogen peroxide or rubbing alcohol. And you're going to put just a few drops in the ear canal. And what happens is those evaporate pretty quickly, and they're also antiseptic. So those are going to help to prevent the bacteria from growing. If there's a little something going on, it may help to curb it off at the path. And we just do that every time. And you can do that throughout the summertime, especially if your child is prone to these. So a little bit of rubbing alcohol or hydrogen peroxide. Just put a few drops, you dry the ear canal out, put 2 or 3 drops in after swimming, and you should be golden throughout the summer. Thanks so much, and I'd love to hear any tips you all have for swimmer's ear as well that you've used in the past. My website is sheilakilbane.com if you're watching this video on Facebook or somewhere else, and thanks so much for watching.